The serratus anterior muscle is located in the torso and is vital to the movement of the upper limbs. The muscle is situated underneath the armpit, attaching itself to the scapular bone of the shoulder and the 1st to 9th ribs. It is composed of 3 sections, the superior, intermediate, and inferior sections. The typical functions of these muscle fibers are seen on the slide. We will be focusing on the forward rotation of the arm by pulling the scapula forward and around the side of the rib cage, the superior movement of the upper limbs, and the lateral medial movement of the scapula. When the scapular bones move medially in the downward motion of a push-up, all 3 components are dominant in the contraction as the entire muscle stretches along the rib cage. The different sections of the muscle can work together to perform one contraction or individually to act antagonistically to another section. Another example of this movement could be seen in the resting position of a push-up, where the shoulders are held in front of the body. The superior section of the serratus anterior is slightly compressed. The primary function of the serratus anterior during a push-up is to stabilize the body by lengthening to lower the body and shortening to raise the body. A push-up begins with an isometric contraction, then moves to an isotonic eccentric contraction as the body is lowered. At this lowered position, the serratus anterior is again performing an isometric contraction. As the body is raised, we see the muscle performing an isotonic concentric contraction.
As aforementioned, the 3 sections can perform different contractions, such as during the positioning of the individual into the push-up. This action is the stimulus. The movement sends a signal to the brain that a contraction is needed to stabilize the upper body. An action potential is then sent to the skeletal muscle to contract. In the synaptic end bulb of the neuron, the neurotransmitter undergoes excitosis. This action potential diffuses down its concentration gradient across the synaptic cleft and attaches to acetylcholine in the sarcolemma of the muscle cell. This then travels down the T-tubules in the sarcolemma, where the acetylcholine triggers the release of calcium ions from the terminal cystinae of the sarcoplasmic reticulum into the sarcolemma. These calcium ions bind to the troponin in the thin filaments. The troponin changes shape, which removes the blocking action of the tropomyosin, allowing the actin-activated sites to be exposed. The myosin cross bridges in the thick filaments, attach and detach to the actin in the thin filaments, resulting in a pulling motion of the thin filaments towards the center of the sarcomere, which is the superior movement of the push-up. The pulling away movement is the lengthening of the muscle during the inferior motion of the push-up. When this muscle is damaged, uncomfortability in movements involving a straight back, such as sitting, standing, and resting, is caused. A weak or damaged serratus anterior may negatively affect your posture. The scapula would have less support due to the weak muscle, and the shoulders would become slumped and rounded, so look after your wings.